Good morning, good morning. We are starting. Let's start. Good morning, good morning. How are you all? How's everything going on? Good morning, good morning. How are you all? I hope you are revising. You revised yesterday's topics? Yes or no? Chalo. Thank you, thank you. Good morning. Good, just hectic times. Chalo. Let's start. Chalo. I hope all great. Chalo. So let's continue. If any doubt, you can inform us. We'll solve that later. Okay. Yeah. Because 2 days there's a break, then the next class. Very good, Sonu. Very good. Okay. We'll revise the start the revision from 26, 7, 8. Okay. And we'll start. Okay. See, sometime dates will change, Sky, because we take classes as per the slot available. Okay. So that's why dates will be sometime, you know, change, and it's not we remove the date, we have rather added that. There was not supposed to be class today, but I'm still taking class because there was free slot. Okay. I have a PG class, so I'm doing it before the PD class. Okay. Chalo. So let's start now. So today we'll discuss about the remaining hormones. So I'll just ask you about the few questions. First, in diabetes mellitus, okay, what do you check? HbA1c, okay. What is diabetes mellitus? HbA1c level, how much? What is the value? I will not take daily, I will just take important, okay. Very good, Arkdeep. Yeah, offline which sir will take? Yes. How much HbA1c? Yeah, more than 6.5. More than 6.5%. Yes, you are right. It's more than 6.5%. Yes. Normal less than how much? Normal. Normal. See, offline also, if you are in Delhi, okay, or Calicut, Hyderabad, you can attend whatever session which are going there. Now you can do anytime, okay, just ask. Okay. You can watch them, Dr. Aspiring. That's not bad, but I will request to watch full video because the full videos are 70 hours. And I've taken extra topics there, extra topic, extra material. So that's why it'll be beneficial. Okay. So normal is, yes, you're right. Less than 6.5 or 5.6, 5.6%. So that is the case. Okay. Thank you, Dr. Faraz. Medicine offline will be on 26th. Okay, 26th. Chalo, I'll start without delay. So I will first teach you about the PTH. So remember PTH. It comes from parathyroid gland. Okay. When low serum calcium, when low calcium. And what does it do? It activate osteoclast, bone resorption, and increases serum calcium, but decreases serum phosphate. So one line summary, it will yes increase the calcium, but it will decrease the, yes, okay. So I'll reply to queries later. Okay. So yes, medicine class anyone can attend who's in Delhi. It's free for all. Okay. Just need to register because seats are limited. Now, what is the condition? So there is, first is primary hyperparathyroidism. So there is a primary hyperparathyroidism. Okay. What happens here? There's an increased PTH level. There's an increase in the PTH level. Okay. Example could be a adenoma or lung cancer making PTH. That is called as our which condition? That is called as primary. Okay. In secondary hyperparathyroidism, there is decreased serum calcium, which increase PTH. So if they give you, yes, and here calcium is more, increase PTH and increase serum calcium. So if you get increased serum calcium, increased PTH, it is primary. If you get low serum calcium but high PTH, it is your what disorder? It is our, yes, secondary disorder. It is our secondary. Are you clear? Yes, very good. Okay. Yes, it activate bone via rank ligand. Okay, very good. I did this in physio revision. Okay, so how? It is via rank. Pathology. ठीक है, फाइन. लाइगैंड है, ठीक है, कुछ और नहीं है ये. डोंट रीड समथिंग एल्स. ओके, इट इज लाइगैंड, लाइगैंड, ठीक है, नॉट लेजेंड. ओके, नॉट समथिंग एल्स. ठीक है. या सो लेट्स रिवाइज व्हाट आर द क्लिनिकल फीचर्स. Clinical features are, first, there is stones. So what happens? Increased serum calcium cause stones. Make stones. ठीक है. Then there is groans. It is due to abdominal pain. So patient, oh, दर्द हो रहा है, बहुत दर्द. So due to abdominal pain. And there are Sunny Leone sounds, that is moons. Psychic moons. They are psychological, so psychic. So make morning sound. Okay. It is due to low calcium. Like example, dietary factor, kidney failure, So anything which cause low serum calcium, okay, you can just remember one cause. Let's say it is renal failure, renal disease, okay. So kidney failure can cause low calcium, okay. So psychic moans, ठीक है, उसमें क्या करेगा, आहा 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 ऐसी आवाजें निकालता है, ठीक है, moaning sounds, okay. Clear? You already know which are moaning sounds. You all have seen lots of movies with lots of moaning sounds, okay. You are pros of the movies, okay, and you know what happens in these movies. They always start with yes, advisor, okay. Are you 18 plus? They ask you 18 plus, and you people type since birth, है ना. So these kind of website you can hear these sounds, okay, moaning sounds. Yes. Chalo. Now also there is what? Yes, bone resorption. Which is subperiosteal. Subperiosteal. Done? Subperiosteal, okay. Then also there is, yes, brown tumor, which nothing but cyst in the brown tumor in bone. Actually it's a cyst, fluid filled cyst in bone. Then there is also what happens, yes, salt and pepper, yeah, pepper pot skull. Salt and pepper skull, okay. Also there is, yes, zebra spine, also called as your rugger jersey spine. Rugger jersey spine, okay. Yeah, okay. See, these are all seen in both primary and secondary. Okay, Mohammad Faizan, they are seen in both primary and secondary. Okay, they are feature of hyperparathyroidism. Okay. Someone is saying Vikram movie theme. I have not seen that movie. In fact, I have not seen any movie. Okay. So for past 10 years, no movie. So yes, 10. I don't know. Maybe 10. Last movie I think I saw was my mother made me see, I think, Bahubali. Yeah. She said we'll all watch Bahubali. So I saw that with my family. The last movie. Well, I think I've seen 5 movies in theater. Only 5 movies I've seen in theaters. Only 5. Okay. Only 5 movies in my life. Okay. And on, I think, TV, etc. I think total 100 movies I would have watched till now. Only 100. Chalo. Time is not there. Na? Time is the issue. Okay. Yeah. So I do watch educational videos. Okay. All kind of educational videos I watch. They are very, very good. Okay. So you do watch educational. Okay. Yes, I have watched any kind of video. Actually, I watch for my curiosity. Like I've even watch videos on dark web. Why? Because it increases your knowledge, understanding. So dark web also I have seen. Okay. Yeah. Chalo. Fine. Okay. So dark web. Chalo. Let's start. So I'll show you the photos now. Let's see. This we have already covered. So have a look at this. Okay. So first is, can you see this black color lesion? This is called as Brown's tumor. It is actually what? Bone resorption, and then it is filled with fluid. So that is called as osteitis cystica also. Osteitis cystica fibrosa. This is your Brown's tumor. This is your Brown's tumor. Okay. Yeah. Fine. Then this is your pepper pot or salt and pepper skull. Can you see that? So black color dots. It's not multiple myeloma. multiple myeloma, basically you have punched out clear cut defined margins. Okay, done. So if they say punched out lesion, that is multiple myeloma. Okay, punch out multiple myeloma. Chalo, next question. Can you see this black spots in the bones? This is not a ring. This is a bone resorption. Can you see that? Soon, very soon, very soon we'll start the mock test. Then these are again the bone resorption areas. Can you see that? So this black are all bone resorptions. Are you clear? ठीक है, मल्टीपल माइलोमा विल जस्ट so let me show you. So this is your punched out lesions. Can you see? So they are, first question, much bigger and they look as if you are doing a punch. Have you seen a punch machine? We used to make punch in the paper. So you can see very clear cut black spot. Can you see that? This is called as, yes, punched out lesion. Am I clear? Yeah, this is the case. Okay. Whereas this is your salt and pepper. You don't see clear cut, we see dots. Can you see dots? 1, 2, 3, 4. So when you see multiple small dots, it is most likely a, yes, hyperparathyroidism. If you see clear cut black dots like this is your punched out lesion. Can you see that? So punched out skull or punched out lesion. This is where you can see again. So are you clear? So they are the punched out lesion. Okay. Done? Happy? Yes, these are punch out lesions. Can you see? So they are very clear cut, well defined lesions that you can see. Okay, very clear cut. If you get dots, it is your, yes. You can watch RR and do MCQs, PYQs. That is very important. Okay, just doing PYQs is also not good. Okay, now let's see rugger jersey spine. Here. So it's also like a zebra spine, black, white, black, white, black, white. Can you see? So black, white, black, white. So this is your, yes, vertebral finding. Okay. So that is the case. Now, what is the treatment? Basically, first is decrease serum calcium by loop diuretics. So decrease the serum calcium by giving, yes, loop diuretics. Okay. So decrease the serum calcium by loop diuretics. Then we can give bisphosphonates. Example, alendronate. Alendronate. Then teriparatide, teripentatide, teriparatide, teriparatide. Okay, clear? What they do is basically they inhibit osteoclast. So what they do is they inhibit osteoclast. and decrease bone resorption. Okay, so they will, yes, तेरी पैरा टाइट, गाली नहीं दे रहा, आई एम नॉट अब्यूजिंग एनीवन, ड्रग का नाम ही है तेरी, तेरी सही है. सो लूप, बिस, बिस और तेरी, ठीक है. सो तेरी alendronide and teriparatide, these are the drugs we will give. Fine, तेरी पैंट टाइट कर दूंगा, जो भी है, तेरी पैराटाइट, तेरी पैंट टाइट, ठीक है, ठीक है, ठीक है, ठीक है. दे विल अकर वेरी सून. ओके, क्लियर. प्लीज अभी जो चल रहा है उसको आप वॉच करो, ठीक है. दे विल अकर सब्सिक्वेंटली. ओके, मॉक टेस्ट, इमेज बेस्ड, PYQ, ऑल विल अकर. ओके, जस्ट वॉच व्हाट इज हैपनिंग. ओके, क्लियर. चलो, तेरी पैराटाइट. Now let's use the file to do the remaining topics. Okay. So Jerry, I just did hyperparathyroidism. Okay. चलो, चलो. So this is what I was discussing, hyperparathyroidism. Okay. So I told you I'll start from beginning the revision. So in hyperparathyroidism, there's an increased serum calcium and also increased PTH, decreased phosphate, increased alkaline phosphatase, increased alkaline. Okay, okay. And I'll be basically covering what? I'll be basically covering today all the endo. Okay, endo will be over today. Okay. Next, stone formation is there. Then there is moans, psychic moans, groans because of pain. Plus there is subperiosteal bone resorption because of osteoclastic activity. Okay. If there is low calcium, it is called as secondary. If there is high calcium, high PTH, it is primary. Okay. And long standing secondary becoming primary, it's called as a tertiary. Okay. Now, bone is brown tumor. Okay, skull is salt and pepper. Spine is rugger, Jersey spine. Treatment loop diuretics, teriparatide. Okay, then bisphosphonate, alendronate, and also cinacalate can be given. Cinacalate. So these are the drugs we will use. Okay. Yes, you are right. Very good. Okay, Ritvik. We should wait after taking bisphosphonates. Very good. Okay, because it can cause, yes, reflux. So that's why we have to stand and wait. Very good. Okay. Now in hypoparathyroidism, there is a decreased calcium less than 8.5 milligram percent, and example is thyroid surgery. So what happens during thyroid surgery? Remove the surgeon by mistake, not all surgeon. So remove parathyroid. That causes hypoparathyroidism. Okay. Yeah, chronic secondary is tertiary. Tanmay, chronic secondary is tertiary. Okay. There is low calcium, but now the calcium levels are to increase. That is called as secondary. Okay. Hypocalcemic tetany. Two signs are Chauziot sign. This one. Okay. Also called as obstetrician hand. So how do the OBG people put their hand inside the female genitalia? Not ऐसे ना. ऐसे नहीं डालते ना. ऐसे. So they will put the finger like this, and then they will insert the hand. This is called a what? Chauziot sign. Chauziot sign. Okay, clear? And also there is, yes, that twitching of facial muscles on tapping the facial muscle. This is called as the caustic sign. It's not Chauviostic, it's caustic. Ka hai ka. It is ka. Okay, so see, I know it's English language is always very, problematic subject. English is not easy. Okay, it is now full of, confusions. So it is very, very difficult subject. Let me show you now. So I'm showing you both the signs. Have a look. So this is your sign. This is a Trousseau sign. Trousseau sign. Can you see this? So when you put the BP cuff and make the BP, yes, between systolic and diastolic, there is what? Ischemia, and it causes, yes, carpopedal spasm. What the other name? Carpopedal spasm. Spasm, also called as obstetrician's hand. Carpopedal spasm. Okay? And this is your, yes, caustic sign. Okay? Very, very good. Okay. And okay, what is this? Tell me, what is this? What is this? On. Okay, this is on. Okay, on. Yes or no? It is on. What is this? What is this? One. How it is one? It should be oni na. Oni. This is knee. Neoplasia. Okay, new. So knee. So it should be oni. How it is one? One or va na. Van ya one. So I don't know how it become one. Okay, that's something like paradoxical. Yes or no? Then what is this? No. This is now. Okay. What is this? This become no. You added W and the K disappear. I have a problem. Why it is not canal? I canal this. I have knowledge. Why we are writing it as canal? यार नहीं लिखना नहीं लिख दो, नो लिखो सीधा. मतलब कनाव होना चाहिए ना ये. 50% वेस्ट. 50% वेस्ट है कि नहीं? So 50% ले भाई रशियन. Okay. Okay, done. Is my name in Russian. Okay, I can read, write Russian also. Okay, I had a very good teacher. Okay, she taught me everything, even writing also, even reading also. Chalo. Fine. So 50%. Okay, it is 50%. Ashish Kumar. Okay. Chalo. Let's start. Sorry, P over. Sorry. I just made a mistake. Chalo. So it is my name. Okay. This is yeah. I by mistake wrote. Okay. What time se practice nahi kara? It is Kumar. So, chalo, let's start. Okay. I don't want to show you my Russian skills. Okay. You can expect if I can write in Russian, then I must be having extreme Russian skill. It's because I stayed with these people. I went to their marriages. I was in village, Drevnia. ठीक है, दिला स्वादबा. ठीक है. And वहाँ पे क्या था पूरा टाइम they will just show me Russian culture morning to evening. I was like a celebrity because I was the only Indian ever to go to the village in Russia. So they were like very happy. So they will be cooking for me. They will bring from farm. पता नहीं मतलब ऐसा like they all village and they will talk out to me about Raj Kapoor, Jimmy. The older ones they will come and they say, oh India, Raj Kapoor, then Amitabh Bachchan, Jimmy. So it was very different kind of place. So let's start. Okay, so old memories. Okay, yeah. So I spent good times there. I stayed almost 6 days there. Okay, it was a very nice memory. So let's continue. Okay. Now we'll discuss the treatment. So treatment of this is we give calcium. We give calcium, gluconate, also vitamin D. Okay. And we can do reimplantation of the glands. Reimplantation of the glands. Okay. Yes, yes, yes. Chalo, let's start now. Now we'll discuss thyroid. So first question is, thyroid have follicles. The follicles have the cells, okay, which contain colloid. So follicles contain colloid and thyroglobulin. TG. Thyroglobulin TG. Yes. Yes. Yes, they are very famous, okay. He's like a superstar in Russia. They all know him. Jimmy, very famous. In fact, his movie earned more than 1,000 crores. 1,000 crore, okay. Top 3 movies in their country are this, okay. Top 3, imagine. Not even Avengers is there. Disco Dancer is there, okay. So I'll just show you the gland. Please have a look at the photo. So this is your thyroid gland in the neck. This is parathyroid, just next to the thyroid gland. These are right and left lobe, the isthmus, pyramidal lobe in the middle, okay. Then this is the next question. This is your structure. When you cut, you see the cuboidal cell and they contain the colloid. Okay. So clear now? So that is the case. Then come thyroglobulin. It is stored in the colloid in the follicles. Are you clear? So it is in the follicles. Chal. Now comes a question, okay. What is the funda? So first sodium and iodide symport occur. So sodium enter enter this iodide plus iodide with the help of TPO, that is thyroperoxidase, okay. They cause the formation of iodine, okay. So they cause the formation of iodine. Then this thyroperoxidase is inhibited by carbimazole. कैसे याद करेंगे? कार में थे और मजे में थे, तो कार में मजे में थे, तो कहां थे मजे में? कार में मजे में थे, ठीक है। तो कहां थे मजे? कार में मजे में थे। सो कार्बिमाजोल मजे में, ठीक है, ठीक है। चलो, या वेरी गुड, ओके आकांक्षा, वेरी गुड, यस। नेक्स्ट क्वेश्चन, कार। सो कार्बिमाजोल और मजे। चलो, थैंक यू वेरी मच ऑल फॉर वॉचिंग। यस, कार में मजे। नाउ द आयोडीन combined with tyrosine and the enzyme is again TPO making MIT DIT. It is MIT comma DIT, MIT and DIT, MIT and DIT. Then MIT plus DIT create T3, DIT plus DIT create T4. So remember, T4 is made by DIT plus DIT. Now T4 is less active, so you convert it into T3, which is most active, by deiodinase. It caused the conversion. So who caused the conversion? Deiodinase, 5-D-iodinase cause conversion, okay. And what inhibit the deiodinase? PTU, propyl thiouracil. It's the drug of choice for first trimester of pregnancy. Otherwise all other condition we use CAR. So remember, pregnancy PTU, pregnancy PTU, okay, pregnancy PTU, but we will use the other condition carbimazole. Done. Carbimazole, okay. Now I'm telling you very important thing, please understand. First is, remember the story that right, first thyroid disorders, they are primary disorders, and pituitary diseases, they are secondary. याद रहेगा? So primary is thyroid, secondary is pituitary, So primary is thyroid, secondary is our pituitary. Are you clear? So which is secondary? Pituitary is our secondary. Fine. So that is the case. So clear now? Okay, now let's start. If there is a primary disorder, there is opposite TSH and T3 T4. It's a 100% exam question. Yeah, so that is the case. And in secondary diseases, same direction, same of TSH and T3 T4. So please remember this formula. It will come in the exam and you should be the case. Okay. Clear? So clear? It is same. ठीक है, so same is there, secondary is same. चलो, next concept, right? I make a table, understand. So this is TSH. Yeah, better I write T3 first. T3, T4, mainly T4 will write. And this is diagnosis. And this is our yes. Example. Please do this table correctly because very, very important. Chal. Let's continue. Next question. Right. If T4 increase, TSH increase, they are in what direction? Same direction. Same. So what is the diagnosis? Primary, secondary? It is secondary, same na? Secondary hyperthyroidism. Example is pituitary adenoma. Pituitary adenoma. Done. Then come if T4 level is increased but TSH is less. It is now opposite. It is primary. Primary hyperthyroidism. It is what lesion? It is your thyroid lesion. So it is Graves. Or could be, yes, adenoma, thyroid adenoma. Sometimes also called as MNG, multinodular goiter. It is what? MNG, which I'll discuss. Multinodular goiter. Then if there is decrease in both, again direction is same, but decrease, so it becomes secondary hypothyroidism. It is what lesion? It is, yes, pituitary lesion. Okay. Fine. So pituitary lesion. And what else do we also see? Okay. Then also like And also what? Yes, also, yes, Sheehan syndrome. Sheehan syndrome. Done now? Sheehan's. Next question. If there is decreased T3-4 but increased TSH, opposite, it is primary hypothyroidism. Example, thyroiditis, like Hashimoto thyroiditis, or also iodine deficiency. Are you clear? Thank you, Hanshraj. Yes, it is what the idea is. Just remember, opposite or same, it will solve all the questions. Are you clear? Secondly, so if there is a primary disorder, even TSH alone can be sufficient. Like example, TSH is how much? 0.525 milli unit per liter. So it is milli unit per nature. Okay. So it is, yes, 0.525 milli unit per liter. Okay. Milli unit per liter. Okay. So that is the funda. Okay. So clear? So that is your, yes, TSH. Done. So that is your TSH, 0.52. Yes. Yes, Rohit. Yes. It is around 1 to 10 is T3. Yes. Now comes the question, what are features of hyper? Just remember, thyroid hormone increase BMR and increase sympathetic. Just these two features will help you remember. So increase the BMR and increase the sympathetic. So can you tell me what will happen in hyper? I make it easy for you. Can you tell me what will happen in hypo and hyper? Tell me. Can you tell me? Yes. Okay. Let's make a table. You tell me it is hyperthyroidism. Pituitary is always secondary, na? Sorry. I just made a mistake. It will be primary. Now it's right now. Second is pituitary. What you are saying? Second is always pituitary. Okay. Fine. Okay, Akanksha? See, pituitary is always secondary. Done? Chalo. Bilkul. So I made a mnemonic. Hyper is like a tiger, cheetah. And hypo is like a buffalo. Mnemonic buffalo. So remember, cheetah hai hyper, buffalo hai hypo. Okay. Yeah, TSH is most sensitive. So it is the most sensitive. Most sensitive. So who's most sensitive? TSH is the most sensitive assay. कब प्राइमरी बताया? गलती से निकल गया होगा, बट अदरवाइज आई रोट राइट ना. सो पिट्यूटरी इज ऑलवेज सेकेंडरी, थायराइड इज प्राइमरी. देखो मैं लिखवाया भी यहाँ पे, देखो थायराइड इज प्राइमरी, पिट्यूटरी सेकेंडरी. ठीक है, ओके. If by mistake I wrote, I am a human, I can make mistake, you also make mistake, na? Clear? Like what the biggest mistake of your life? Like X. Okay, so that is one of the biggest mistakes of the life, X. Okay. Okay, let's continue. So hypo and hyper. Okay, now let's see the features. So as I told you, there would be BMR increase, decrease. If BMR increase, what do you need? Less or more food? Yes. So appetite will increase because you're eating a lot. Decrease. And if you eat a lot, what happens? Yes, there is what? There is more food. So GIT become more active. So GIT movements will increase. There is diarrhea. Here constipation. Here constipation. तो कैसे याद करेंगे? कौन खाएगा और निकालेगा? So who's eating and shitting? It is your hyperthyroid. And who doesn't eat, doesn't shit, na khaya na nikala, that is your hypo. So hyper, eat and shit. Then it causes what? Also increase tissue effect, tissue breakdown of muscle, protein, okay, bones, etc. Here it is accumulate. Proteins don't break, they accumulate. Protein accumulate under skin, under the skin they accumulate and cause edema, cause generalized edema. Called as mixed edema. तो ये है इसका, ठीक है. सो टिश्यू पे इसका ये इफेक्ट है, ठीक है. तो वेट क्या होगा? ऑब्वियसली इसका लॉस होगा वेट, बिकॉज ये सब कुछ तोड़ रहा है. तो वेट लॉस, वेरी थिन, स्लिम. इट इज गेन, गेन, obese. So that is why one line summary, also lipolysis. So who is eating and still slim? It is hyperthyroid that everyone want to become. They want to be slim. So that's why there is, yes, there is very slim body weight. So very slim body weight. Fine. Whereas in the case of others, there is going to be what? Fine. Yes. And what doesn't eat still become fat? It is your hypothyroidism. What the female with hypothyroidism say? डॉक्टर साहब मैं कुछ भी नहीं खाती फिर भी मैं फूलती जा रही हूँ. बिल्कुल बहन जी, आप सही कह रही हैं, आप गलत नहीं कह रही. सही में आपका यही हो रहा है. आप अपने पति से कम खाती हैं फिर भी आपका वजन उनसे तेजी से बढ़ता जा रहा है और कुछ ही दिनों में आप एक हॉकी स्टिक से फुटबॉल बन गई हो. बिल्कुल बहन जी, बिल्कुल. ऐसा क्यों हुआ? क्योंकि आपका थायराइड कम हो गया है बहन जी. आप प्लीज चेक कराओ. तो इसीलिए क्या बोलोगे? बहन जी TSH कराओ और अपना इलाज कराओ. सही है. सो दैट इज योर TSH, that is your TSH. okay, चल नेक्स्ट क्वेश्चन. ऑल्सो क्या होगा इसमें? हीट. हीट. So you know what happens in cheetah? Cheetah is very hot. So there is increased heat production. Heat production. Okay. Yes. Sometime I explain in Hindi also, just for the people who can get it. Yes. So a female getting obese is your, yes, hypothyroidism. Okay. Heat production. That is called as thermogenic action. Thermogenic. Okay. Thermogenic uncoupling. This could be exam question. Thermogenic. Okay. So what is the result of heat production? There is heat intolerance and there is cold intolerance. So that's why sometime what happens is there would be a person who will always be starting, hey, bhai AC, please AC, bhai, please AC. So they're always wanting AC. So who want AC? Cheetah, he's hot. Whereas the buffalo always is sitting in the corner and they want blanket. So what want blanket even in the summer? That's the case. Okay, clear? And if they both stay, like let's say husband has hyperthyroidism and the wife has hypo. So hyper. So husband is slim like this and wife is like this. Okay, and imagine they are one day sleeping and while sleeping the wife leg comes over the chest of the husband. ऐसे तो क्या हो गया? While sleeping the feet of this lie on the husband. Husband is hyper and now it causes severe dyspnea and he tried to lift the hand, this, but he can't lift the leg. Why? He himself is 50 kg and the leg is also 50 kg. So how can 50 kg person lift 50 kg? So now he is going to die. He is going to, yes, fine. Okay. And now what happens is he start pinching her. He start pinch. So because of pinching, she is not still awake, but she just asks, why are you pinching me? What happened? Why night time? कहता I have to ask a question. क्या बोलता है? I have to ask a question. So what the wife say? Are you mad? Is it time to ask question? Stupid person. कहता नो, इट्स अ क्वेश्चन ऑफ लाइफ एंड डेथ, लाइफ एंड डेथ. So what the wife say? Okay, ask me. Wife is not even aware. She is so big, she is not aware of her body position. क्या बोलती है? हाँ बोलो, क्या पूछना है? कहता one should die in a flash like this, or he should die slowly. So die slowly, painfully, or die fast. So what the wife say? Why should someone die slowly? है दर्द में मर मर के, एक ही बार मर जाए झटके में. Die in a flash, in 1 second. So they should die immediately, not slowly. So he say, then please put your other leg also on my chest. Put both legs on my chest so I can die immediately. Okay. So that is the yes joke for you people. Okay. So put both the leg over my chest. Okay. Chal. Okay. ठीक है. I don't know why students don't seem to be interested in studying. Why they don't come to classes. Okay. I even crack jokes. I give good, easy, simple mnemonics. I even give a summary which is easy to remember. Buffalo versus tiger. Okay, I make my level best efforts. Okay, clear. I want all the FMGs to pass, the results to improve. Okay, even giving for free. चलो फीस पेड वाला बच्चा है उसको चलो ठीक है. Maybe they are very rich. That's why they paid the fees and not coming to classes. Even free sessions, people are not coming. Okay, so I don't know what is the mistake and what is the error in this case. So that is something I am not able to understand. Why people are not willing to come study and watch. Okay, there are only two reasons. Either they are not studying at all, so that is not me or any other doctor, or they are studying with other doctors and not me. That means I am an inferior teacher. So that's why it create a paradox. If I am inferior teacher, I agree they should not come to my classes. Okay, but they should tell me why I am inferior, why I am not a good teacher. What I feel is maybe because I'm not a famous NEET PG teacher, that's why they don't come to my classes. They only value NEET PG. Like if any NEET PG teacher comes, they will immediately go and attend the class. There will be 1,000+ live viewers in the NEET PG teacher. Clear? Like I saw that day 5,000+ people were watching live session of that Dr. Janev. 5,000+. अपने 200 भी नहीं आ रहे. मतलब I think I am an inferior teacher. ठीक है. So that is what I feel. I am a inferior teacher. ठीक है. Okay, that's why people are not coming. चला. Or maybe I should go for NEET PG. I should focus on NEET PG, become famous in NEET PG. I think maybe then they will come. Okay. So recently what happened, we had 5 students who joined for December. They joined for December, okay, 2023. Then yesterday, why I was upset was, yesterday they said we want refund. And you know what they said? Refund. तो उन्होंने बोला why? कहता वो कोई नया कोचिंग खुला है इन गौतम नगर, some new coaching, and in that new coaching they are having a medicine by that app teacher. Okay, you know famous medicine. तो कहते वो पढ़ाएंगे. तो उन्होंने कहा but आशीष सर also teach. कहता आशीष सर तो we can get free also ना. तो दे सेड आशीष सर का तो फ्री में लेक्चर मिल जाता है यूट्यूब पे और हर जगह पे वो फ्री में लेते हैं. ठीक है. तो वाई वी शुड पे मनी. सो दैट्स व्हाई दे सेड कि उनका तो फ्री में अवेलेबल है. ठीक है. तो वाई वी शुड पे मनी फॉर आशीष सर. विल पे मनी टू द इंस्टीट्यूट विद दैट. सो दैट मीन्स मैं सी हूँ बहुत बड़ा जो फ्री में क्लास ले रहा हूँ, फ्री में लोगों की हेल्प कर रहा हूँ, मुझे नहीं लेना चाहिए. सो दैट्स व्हाई आई फील दैट इज ओके. सो मेरा इमेज ही ऐसा बना. आई थिंक माई इमेज इज बिकम लाइक दिस कि आशीष सर मीन्स फ्री. So coachings are other. Ashish is like Dharamshala charity house. And who pay money in charity? Charity में money कौन देता है? So money will spend only with good coaching, famous coaching, 80K plus coaching. ठीक है ना? So only they want. So I think I have created a blunder. I should have been not doing anything like this. Clear? Because पैसा भी उन्हीं को मिल रहा है, नाम भी उन्हीं को है, viewership भी उन्हीं की आ रही है, फ्री क्लास भी उन्हीं की पॉपुलर है. They are having much bigger respect, owner, Porsche खरीद रहे हैं, they are buying bigger Mercedes, BMWs, okay, and I am just feeling left out कि I'm not even having students in my class. So I think that is the problem. Okay, clear? So people who have more money, they go there. मतलब they have become like iPhone. I become like maybe some Oppo, Vivo. So NLC is like Oppo, Vivo. I think as per the people perception is okay. चल, let's come back. Okay. I don't mind doing charity, okay? I'm very happy doing charity. But point is, we also need money to survive, no? Clear? Even people are not happy because I'm not able to pay them good. Okay, they always keep saying, ki, sir, you don't pay us good. How can I pay? I don't pay myself. Okay, there are so much loss in multiple places. I am myself bearing the cost from whatever I earn from my classes in the PG sector. That money I go and bring in FMG sector, NLC center, some places. So whenever there's a loss, I pay from my own pocket. So I don't know how long we'll sustain. Maybe one day we shut down. And if we shut down, then there'll be no more classes anywhere, because then I'll be signing contract with some app and I'll become an app teacher. Whatever they do, I will do. Okay, no free classes, nothing. Okay, so I have lots of offer from app, etc. They want me to shut down everything, all coachings. Okay, sell them whatever business I have and become a part of their team, and then whatever they do, I will do that. If they say 1 hour free, I'll do 1 hour. If they say no free, no free. Okay, chalo, let's see what happens is. Okay, yeah, because they just do MCQs. Okay, if you see the truth, all other teacher, they don't revise, they just do MCQs. Okay, and MCQ से क्या है यार, वो तो आंसर ही बताना है, ABCD मेन तो थ्योरी है ना, ये कौन पढ़ाएगा? हाइपो हाइपर में क्या होगा, व्हाट इज द फीचर, हाउ डू यू नो TSH इज हाई लो, दे डोंट टीच, दे जस्ट डू MCQs. ओके, सो MCQs तो कोई भी करा देगा. चलो आगे चलते हैं, लेट्स स्टार्ट. ओके, sorry for daily giving same thing, but again it feel very painful, people asking for refund because आशीष सर तो फ्री हैं. बिल्कुल सही इमेज बनाई है आप लोगों ने, यू मेड अ वेरी गुड इमेज ऑफ मी. आशीष सर इज फ्री. You know, I get daily calls, sir, can you pay us money? Sir, can you pay our fees? Sir, I am having issue, my family issues, problem. So I give them access to the NLC app lots of time. Sir, even asking me for money, I have given money also lots of time. Even recently I was frauded. Someone asked for money, I sent 10,000. Then I got, another person call. He said ki don't pay, this is a fraud, always show fake report about mother having some ICU condition, they are not. So again I feel very bad. Okay, I've been completely taken for granted by most of the students. Chalo, let's start. Next question. So there is heat production is increase. What is increase? Heat production is. PDF I have already shared in the group. Okay, so next is there's also what? Sympathetic, increase sympathetic. So that cause increase sweating, increase heart rate, BP, palpitations, okay. Palpitations. Here it is decrease. Okay, decrease, okay. Also increase reflexes, decrease. So everything is decrease here. Okay, and finally on the brain, in the brain there is what? In the brain, I just spoiled my throat teaching daily and taking daily session. So brain, there is alertness. So there is alertness, alertness is there. Okay, so alertness. Okay, there's also decreased sleep. So there is insomnia, there is hypersomnia. So what keeps sleeping? This buffalo keeps sleeping. So buffalo keep sleeping. Okay, hypersomnia is there. So what is there? Hypersomnia is there. Okay, insomnia is there. Okay, I think that is sufficient. So if they mention the findings like insomnia, restlessness, anxiety, they are yes. And if person is sleeping, also decrease IQ, that is dementia occur, can cause cretinism. They all are features of hypothyroidism. Are you clear? So please remember this table, it will help you solve question. I promise. Okay, I have experience of exam. I have given NEET PG myself. I've seen all the previous year question, and I can tell you much better way to remember the finding hyper hypo. Also, what the table, this will surely be there in the exam. So let's see the disorders. This is RAIU. What is RAIU? Is radioactive iodine uptake, and we use iodine 123 for test and diagnosis. 131 is for ablation, that is destroying the gland, and technetium 19 again for diagnosis. Okay, so what is for diagnosis? 1 2 3 diagnosis shuru start. And what is 131 is ablation. 131 is ablation. Okay, this is normal RAIU. You see black dots, that is normal gland. If you see increased dots and bigger size, it is grave. So grave is hyperplasia of both the sides, right and left lobe, and it causes increased activity. Then adenoma is increased dots in one area, that is increased activity in one particular area. I'll show the photo also. And if there are less dots, it is thyroiditis. Okay, yeah, we can use that in Hurthle cell carcinoma also. Yes, let me show you RAIU again. So let's have a look at RAIU here. So let's see RAIU. So this is the RAIU normal. Okay, A is normal, B is grave. We can see very big size. Then these are multinodular goiter, MNG. What is MNG? Multinodular goiter. And this is toxic adenoma. This toxic adenoma. Okay. See, 125 is not used nowadays. Mainly we use 123 or technetium. Okay. And this is thyroiditis. You can see the gland doesn't even show activity of even 5%. That is called as thyroiditis. Are you clear? Thank you, Shrijita. I try my level best to help. If I have money, I'll help more. Okay. If I get more money, I can help more. But problem is, there's a paradox. Okay. People give money to those who don't help them and don't do anything extra. They are proper businessmen. I am not a businessman. I try to help people. If I have money, I can use it for better purposes. Okay. Like I have a dream to open research lab for me. That is again pending because of same issue. Because if I spend my money in lab, then if in future NLC need money, how will I have? I need to have reserves. Plus I want to open an orphanage plus old age care so that old people don't have any family and kids who don't have parents, they can live together. So that's my dream to open by this year. So if I get good amount of admissions and money, I can really open that and really make more people happy. So I don't know what the paradox is. I think money only goes to people who are just using it for luxury. It doesn't go to people who actually want to help. That's why I think India is always going to be a sad and poor country, because once a person become, let's say, a very rich, he start saving for himself. Okay, everyone want to be rich, to have a luxurious life, big house, big car. Don't want to give to society. That's why we are having this problem. If everyone try to help other, then India will not be poor. Rich people can help all the poor, and ultimately everyone will have good lifestyle. Okay, so look at this. If you see black dots, these are normal activity. Okay, this is very big. Can you see that? So very big, both side it is. If you see one big, it is adenoma, toxic adenoma. If you see multiple nodes, that is multinodular goiter. Multinodular goiter. Let's start now. Okay. So this we have discussed. Now let's discuss the disease. First and the foremost is Graves' disease. Now Graves' disease is both type 5 hypersensitivity, also hypersensitivity, and it is also, yes, type 2. Why? Because there are antibodies formed. But better go for 5 more than 2. Better go for 5 compared to 2. 5 more than 2. Now in primary hyperthyroidism, there is what? T4. There is increase in the T4 and TSH is decreased. TSH is decreased. Okay. Okay. It's an autoimmune condition. There are antibodies formed. So what is formed? There are antibodies formed. Okay, so antibodies. Example, LATs, long-acting thyroid stimulator antibody. They are antibodies against TSH receptor and they stimulate the TSH. So it make more T3, T4. Also, there is the HLA, DR3, then B1, B8 and also A1. Okay, so that's the case. So it is, yes, HLA, DR3, B8, HLA, DR3, B8. What are the clinical features? So what are the clinical features? There's a triad. So there is a triad or the triad dermopathy. So dermopathy, there's a pre-tibial edema, myxedema, red brown. Let me show you. So pre-tibial myxedema, this is the case. So can you see that? So it's a red color, reddish brown pigmentation of the skin. It is basically, yes, because of hyaluronic acid deposit. Okay. So clear now? So that is the case. Okay. Yes. Dog. Yes, mnemonic is dermopathy, ophthalmopathy, and and there is goiter, hyperthyroid. God. Next question. There is ophthalmopathy. So it is dog mnemonic. I made it DOG. Dog. तो कुत्ता बन जाता है. हाइपर ग्रेव. ग्रेव कुत्ता से ग्रेव वाला कुत्ता. ठीक है. चलो. Next question. So there is a steering loop called as Kocher sign. It's because of exophthalmos. So what is there? Exophthalmos is there. So Kocher sign is steering loop. Okay. And there is exophthalmos. So it look like the auntie, the Indian neighborhood aunties. So what the aunties do? When they see a colony boy and girl going together or going towards some hotel, etc., maybe some Oyo, they will look at this. कहाँ जा रही? Okay, so they are looking and they will immediately inform the parents of that kid कि where are they going. Okay, clear? So that is your what? Indian auntie steering look. Indian auntie. Okay, it's called as what? Kocher sign. Kocher. Okay, so क्या देख रही है? आंखें कोच लूंगी तेरी. Okay, I will. Yes, Kocher. Also, there's a puffiness, swelling of the eye, there's chemosis, redness. Then there is paralysis of the convergence. Okay, so can't converge the eye. Then there is also lid retraction called as Dalrymple sign. So all these are the signs of this. Okay, fine. And there is also hyperthyroid features. Which one? Wait. Weight loss, increased sympathetic, increased appetite, heart rate, BP, insomnia, increased reflex, all are there. Okay. Then what is the treatment? If it's a younger patient, less than 45 years, we use the anti-thyroid drugs. What we use? Anti-thyroid drugs. Okay. Now remember, carbimazole is preferred because it's longer acting and more potent, and PTU should be used in pregnancy. Should be used in the pregnancy. Okay. So PTU should be used more in the pregnancy. Yes. Okay. In older patient, ठीक है, अब they are old, क्या करना है? काट दो. So in old people, we should cut the thyroid. Hemi, subtotal or hemi, called as Hill's operation, or if not fit for surgery, we can use radio iodine ablation. What you can do? Radio iodine ablation. But if pregnancy, PTU. This is again a PYQ. Thyroid storm is basically excessive increase in sympathetic, especially during surgery. That is called as thyroid storm. There's arrhythmia, hemorrhage, hypertension, internal bleed, very serious side effects. So there, what we do? We give PTU plus beta blocker. Okay, can give hydrocortisone, but main drug is PTU plus beta blocker. PTU plus beta blocker. Yeah. Hashimoto. Now we'll discuss hypothyroidism. India, most common cause can be thyroiditis, but poor countries and endemic areas. So poor and endemic areas, it is iodine deficiency, because in India most places nowadays we have iodinated salt, and if there is iodinated salt, there is obviously, yes, thyroiditis is the case. Okay. Yes. Next question. Autoimmune, we have HLA. Autoimmune, we have HLA, B3 and DR5. B3 and DR5. It's DR5. DR5. Okay, DR5. And its type 2 hypersensitivity, there is anti-TPO thyroperoxidase and also TG antibody thyroglobulin. Histopathy, Hurthal cell, also WBCs, infiltration. Now, first there is hyperthyroidism. Why? There is a leakage of T3, T4, but we can give beta blocker PTU. Later, after years, the gland is destroyed, so it causes hypothyroidism. Treatment is levothyroxine. Well, the treatment is levothyroxine. How much? This was again a PYQ. The dose is, yes, 1.6 microgram per kg per day. This was the PYQ. Yes. So mnemonic I made was Hasti hui moto. She is obese, plus she is always, sleepy and smiling, and she is having what cell? Harthal. Harthal, Hashimoto, Harthal, Hathi or Hasti hui moto. Hashimoto, Hathi. Hasti hui moto. Hashimoto. Next question. If there is a myxedema coma, if the patient enter coma, then we give leothyronine IV and also thyroxine and thyroxine. So we'll give the thyroxine. Okay. Next question. If there is a viral infection, so remember the mnemonic viral is quervens. So if there's a viral, it's a, yes, querven. Okay. So querven. So remember, subacute is viral or quervens. Vens, there is a sore throat, fever, pain is there. Okay. And it is first hyper, then hypo, then normal. So that's why self-limiting disease, doesn't affect for much longer, and treatment is NSAIDs. So we can give NSAIDs. So what the treatment is? NSAIDs is the treatment. NSAIDs. Okay. Then there is riddles. Riddle is fibrosis of thyroid. If there's a fibrosis, the gland become hard. So what the gland become? It becomes hard. It compress the esophagus. It will compress the esophagus, trachea, that cause dysphagia, hoarseness and hypothyroid. Treatment is levothyroxine. So what is the treatment is? Levothyroxine. Levothyroxine. So let me give a summary. So I'm closing this file. So let me give a summary. Remember, if there is a hypothyroid, there will be weight gain and increased sleep. That is hypo. That is for sure, it is hypo. Yes. Now, what do you do? First, if there is the autoimmune, most common, then Hurthal cell, etc., etc., then we will suspect Hashimoto. Hashimoto. Okay. Treatment is levothyroxine. Levothyroxine. Okay. Yes. If there is viral, fever, pain, suspect D-querven. D-querven. Okay. Fine. So D-querven. D-querven. Yeah. It will improve. It is very good prognosis. Reason, it will self-limiting. Good prognosis. Why? Self-limiting and correct. So just need to give painkillers and NSAIDs. The patient will recover very soon. And if there is a hard gland, hard fibrosis, and this what do you say, dysphagia, then think of what? Then think of our, yes, riddles. सही है. चलो So I think I will end here because I have 2 o'clock other class. So I have to prepare for that. I have to, yes, I'll take a break, then put the keys, login and everything. So I'll finish here. So endo we have finished. Endo is over. We'll start with cardio neuro in the next sessions. Okay. That'll be from 26. Okay. So 26 we'll have the next class. Okay. So I'm ending it now. Take care. We will meet soon. Okay. Fine. Take care. Thank you very much for coming. We will study more and more and more. Take care. Bye bye.